Hello, this is Michael from NJ Neuropathy, and welcome to this webinar. We're very glad you're here. In today's session, we'll be sharing a cutting-edge neuropathy breakthrough that has helped thousands of people reverse and even eliminate their neuropathy. I'm Dr. Charles' son, and I'm happy to introduce my dad, Dr. Charles Ferrante, who has been a natural healthcare doctor for over 40 years in New Jersey.
Thank you, Michael, for that introduction. I want you to imagine a life, getting parts of your life back without drug, surgery, or injections. I'm Dr. Charles. The information I want to present with you today is absolutely life-changing information, especially in today's healthcare climate. Can you imagine enjoying your life again without drug, surgery, or injections? Now, most people that come to this workshop are looking for solutions to their problem. And most people want to find out if I can help them with their problem. So at the end of this webinar, I'm going to go over some ideas on how you can come in to the office to see if I can help you and check you. So if you have any of these symptoms, the numbness and the burning and the sensitivity to touch, or the issues with burning, with balance issues, you are in the right place to get this information. Now, here are three of my patients, Alex, Mary Ann, and Donald. They had those symptoms or similar symptoms. And what we do is we help people reduce these symptoms with our 4-part technology by 60 to 90% in 85 to 95% of our patients in a period of anywhere from 1 to 18 months.
I had problems with neuropathy because of my diabetes. And I saw the presentation, and it all made sense to me. My life's too important to be living the way that I'm living before I came for this therapy. My life was declining, my quality of life. Now, things are coming back. There are so many things that I feel good about. The confidence, the ability to be able to enjoy a round of golf.
So I came to see Dr. Charles, and this is when my life began to change. He was a man that cares. He wants to make people better, and that's what he did for me.
Now, I want to share with you why I do what I do, and I want to go over my dad's story. In 1992, my dad died of cancer, but one of the symptoms he had was one of his toes was turning black, and he was a patient at Valley Hospital in Ridgewood, New Jersey. And I basically didn't want them to really amputate his toe. I found out some information how he may be able to get help with this using natural nutrition. And we actually did that. We went to a clinic outside of Houston, Texas, in Mexico. And when he came back, his toes started turning pink. The picture, my mother's in the middle there. She's 95 today. And I'm all the way out there on the right hand, and that's my sister. So that's one of the reasons, because I never forgot that story. And I like to think that I think outside the box. And in 2012, I started my quest to learn how to help people with neuropathy. I want to share Michael's story because the key here is motivation. If you are motivated to do the best you can for your health and seek out things that are going to help you get healthier without drug, surgery, or injections, that is a really good thing. Michael had gone to the head of peripheral neuropathy at Columbia Presbyterian 3 years prior to seeing me, and they could not help him. And he was near at the point what we're going to talk about today is a drop-off point where I could not help him anymore. But he's a success story, like a lot of my patients are. They come to see me. He's reduced his neuropathy significantly over the last 6, 7, 8 months, and he's able to do more things. And that's really why I do this every week in 4 counties in New Jersey. And because of the situation, we weren't able to do live seminars in different hotels, and that's why we're doing this webinar right now. So we can still reach people, because this disease, folks, is progressive. Nothing stops it. You're going to find out a lot of information in the seminar. You're going to see a few of my patients' testimonials in the beginning here. So stick around and learn and get this information so you can make an informed decision. So we're going to explain a few things here. We're going to explain why medicine has not come up with a solution to reverse neuropathy, why Big Pharma doesn't want you to know about resolving these conditions at all. There's no interest in them to do that. And I'll explain why. New scientific methods that improve these conditions rapidly at home. This is a home-based program. Before the situation where we could not do these particular webinars, I still had patients do these things at home. So 95% of our program, you're going to find out, is done at home, is done through telemedicine. Even our exam can be done virtually. We prefer you coming in the office. We'll talk about all that. But I want you to know from the very beginning, can you imagine getting rid of these symptoms that people come in? So let's talk about what you have to do to get there. So first question is, everybody show hands or whatever in the chat box. Are you really happy with your present health? Are you suffering neuropathy or chronic nerve pain? Do you have any of these symptoms? The numbness and the diabetic nerve pain, the sharp electric pain, the burning and tingling? Do you have the difficulty in walking, or you have issues with when you touch things? You have pain when you're walking, balance issues. These are some of the things that people come see me with. Most patients are relying on medications or injections to manage neuropathy. I totally get that, because you got to get through the day. You have to function. You have to do what you have to do. So I understand that. But these things, they just manage the pain. They cover up the pain. They don't get to the root cause. And we're going to talk about that in this webinar here. And the problem continues to get worse, because this is, like I said, I'm going to use that word again, this is a progressive disease. So you can potentially, potentially have long-term damage, and God forbid, can even lead to amputations. 24 million Americans in this country are diabetic. Almost 50 million people are pre-diabetic. That's just one of the causes of neuropathy. It's only 30% of neuropathy is from diabetes. 70% is from something called idiopathic. But here's some of the medications that are given that my patients come in. They tell me how many milligrams are taken. Gabapentin, Neurontin, amitriptyline, Cymbalta, Lyrica. These drugs are used actually off-label to treat neuropathy and really just mask the symptoms. They are actually used for anti-depression and anti-convulsive type situations. So I want to explain to you today, once and for all, a situation that you can do to help yourself. And we do this all the time in our office. 85 to 90% of our patients get results. So let's go over the breakthrough treatment and different things that you can understand. But before we get to that, I want to explain what is neuropathy. So if you look at this slide, you see the drawing on the top. So neuropathy is a disorder of the peripheral nerves. This is a disease of the peripheral nerves. It's progressive, that continues to deteriorate. You see the normal blood vessels and the normal nerve on the top. You have the myelin sheath. So the blood vessels, the capillaries, basically feed the nerves. Here you go over a couple of analogies to explain this a little bit. The middle one is you see a decrease in the number of capillaries. These blood vessels are getting diseased. And then eventually the nerve shrivel up when the blood vessels disappear. And this continues. So many docs prescribe medications and see what happens. You go to your primary doc, and there's no difference to go to a specialist. They're still going to give you, the same drugs. And that's not good, because they all like I said, they just mask the symptoms. So basically, peripheral neuropathy is a common condition in the United States. It is a chronic condition and occurs in any age. It's all common mostly in older adults, but 1 out of 10 adults in the U.S. suffer from peripheral neuropathy. It's the most common cause of neuropathy is diabetes or idiopathic. And idiopathic, like I said before, 70% is from unknown. You get it from chemotherapy, from stenosis, organ disease, all kinds of issues you can cause idiopathic neuropathy. So the truth is, medications only cover up the real problem, and often there are many, many, many side effects. Most of my patients, the average person over age 65 is taking 18 different medications That's terrible. It's incredibly bad. So we want to try to help you, get away from that situation. And we do work with your medical doctor when we do this, by the way. So there are basically side effects, with strong medications. The symptoms continue. This is a situation here you don't ever want to get into, folks, where you get amputations. The blood flowing to your nerves gets restricted until they eventually die. And amputations can be an eventuality. Like I said, 80,000 amputations a year. So you've probably been told by your doctors, nothing you can do, you have to live with it. I am here to tell you there is something you can do with the situation. The current medical system simply just addresses the symptoms instead of the actual problem. Pharmaceutical companies make billions and billions of dollars on prescription drugs, tons of advertising on TV. You have almost, like I say, you have two wash machines at home. You have your regular washer to do your clothes, and you have that TV. 21,000 commercials on pharmaceuticals before the age of 18. This is what you're seeing. So they bombard you, millions of dollars are spent every day to tell you they have the fix for you, but they don't, folks. In an article from Medline Plus, you see basically this article says that there are more people killed by prescription narcotics, more than heroin and cocaine combined. Gabapentin was just added to the list of addictive drugs with opiates. Bad stuff, folks. Really, really bad stuff. So our healthcare and insurance system focuses on acute conditions. Now, I want you to remember, they'll pay for an amputation, they'll pay for the medications, but, 75% of doctors are for chronic conditions, and neuropathy, diabetes, heart disease, and many other diseases are considered chronic conditions. What you're learning here is that medications, if you haven't got it by now, can give you temporary relief, but it's really, really, really not the long-term solution. So our focus in our office get you on a custom neuropathy recovery program here to get you off the medications and to put you in a path of whole body healing. We don't just treat the symptom, we just don't treat the neuropathy. We put your body in position to heal itself. And as a natural health care doctor for over 40 years, that's how I think, that's how I do what I do. And that's the key to this. You want to work with someone that does this all the time. This is my specialty, folks, helping people reverse neuropathy. Yes, I have a chiropractic practice, and I do that also, but this is my main focus. Now, I want to give you an analogy of your automobile. Now, we all have these computerized, things that tell us when there's a problem, in our car. But years ago, when we used to have just a light, a check engine light. And so you go to the mechanic and you find out, hey, you got something going on with the engine, you hear this noise or whatever. And the mechanic says, I got to diagnose your problem. You're not just going to walk in there, he's going to give you, here, do this. He's got to diagnose the problem. So you have to come in, you have to see me, you have to check, you have to see what's going on. You just don't, boom, here, just do this thing here and take this. It doesn't work. So basically, is a solution covering up your pain or symptoms with medications? No. It'd be kind of like putting a black piece of tape over the check engine light. Is that going to solve your problem? Yeah, maybe you drive another 1,000 miles or two, and then all of a sudden, your engine seizes or something like that, and that is a problem. So basically, the key here is this. As I mentioned, these are the common symptoms here that people come in with. These symptoms are your check engine light telling you there's something wrong. Are you going to ignore them as this disease progresses, or are you going to find out, hey, can I get to the cause of this problem? So neuropathy slowly gets worse, especially the last 2 to 5 years is what we call a takeoff stage. It quickly deteriorates. And I don't want you to wait that long. We get people in all different stages, but when you get to this point that you're desperate, you don't want to get to that point, because there may be a point what we call the drop-off point where I can't help you. So don't wait for that drop-off point. 85% nerve damage. Damaged nerves can result in loss of mobility, paralysis. You're going to lose your independence. You're not going to be able to do what you want to do, even organ failure. Our program is designed to stop the progression of neuropathy and reverse the nerve damage before it's too late. That's the key, folks. Don't wait before it's too late. Really, honest to God, I want you to understand that no matter what you do. Because you know what? If nothing changes in what you're doing now, nothing is going to change. So, you wind up going to one of these things here, one of these walkers, you struggle to keep your, every step. Maybe you're looking down when you walk. Maybe you start shuffling your feet. Maybe you do things that are, holding on to the wall in your shower, hugging your wall when you wake up at night to go to the bathroom, just so you don't fall. These are really big problems, and potentially, you can burden your family. Now they got to take care of you. You really want that? You want to keep your independence, and this really means a lot. And I see patients in front of me, and I feel for them, and I feel their anguish when they come see me. And you know what? After a period of time, I see them changing right before my eyes, and I see what wonderful things happening, that they get parts of their leg back. It's just a beautiful thing, folks, to see this. And I want to see this in you, obviously. So this is a quick article. Falls are serious and they are costly. 1 out of 5 falls causes serious injuries, such as broken bones and head injuries. In fact, over age 65, 1 out of 4 people who have a fall have this. They can actually it's 1 out of 10 can die from this fall. That's not a good thing, folks. Not a good thing. And this is from the CDC. So there are different types of neuropathy. The first one I want to go over with you is if you ever notice if your foot bruises and you can't feel like your nerves are starting to die. This is what we call, pins and needles and things like that, numbness. This is small nerve fiber neuropathy. And we want to check you, for this to see if it is that. Peripheral neuropathy is the leading cause of amputations, like I said. Now, do your feet feel basically that they're like in a block of ice, or do they feel like, do you get that shooting pain keeping you from sleeping at night? Or does it feel like there's other kinds of pain, damage pain from burning? So this is C-fiber neuropathy, and it's something we want to check. So I'm here to tell you that there is another option. Our program is actually proven that it works. That is really important. This 4-part program, the devices that you use at home, the 2 devices, and I want to go over that with you right now, how we reverse neuropathy in your own home. So the body's an extraordinary healing machine. It can recover from chronic conditions when you give it the right nutrition and you do healthy activities and therapies. The body can actually heal itself from inside out instead of outside in, when it's not hindered by toxic drugs or poor health habits. We got to maybe change some of those poor health habits that you're doing right now. Thomas Edison had this quote. He says, and he invented so many things, right? So many different things that Thomas Edison invented. He says, a doctor of the future will no longer treat the human frame with drugs, but rather cure and prevent. Here's the key, folks: prevent disease with nutrition. So there are 4 vital components of our program to recover from neuropathy, and let's go over them. The first one is electromagnetic therapy, and this particular therapy is a therapy that you use at home. It's a particular device, and the technology has 21 peer-reviewed studies with 97% success with peripheral neuropathy. This is just one of the 4 things we do. Just this device gets 97% success rate. The other thing we use, which is important, and now, I want to explain this a little bit better. I want to give you this analogy here. This is the leaves, represent the different types of peripheral nerves. Remember, we went over small nerve fibers, large nerve fibers, and the C fibers. So think of the roots as a small blood vessels called capillaries, and leaves and nerves. When you decrease the number of capillaries, remember the capillaries are diameter 1 cell, and they're near the tipsy toes, near the surface, near the tips of the fingers. They can get clogged really easily, and once they get clogged, those nerves, which are represented by the leaves here, they start dying off. And yes, there is a point that you may be able to save the plant here. Maybe you went on vacation, you come back, you got to water it. A lot of times, though, folks, you can't save it. and that's when the nerves die, and that's when I can't help you. I implore you, folks, don't wait till that happens. Nitric oxide is one of the nutrients we use. It's also a particular thing that the body produces naturally. Our devices, a low-level A we're going to talk about in a second, and the electrical therapy helps the body release nitric oxide. We also boost the nitric oxide with nutrients that we give you in our program. I'm going to go to that a little bit. This is electrostimulation. This particularly is a therapy that will assist in the growth of the nerves and re-educate the nerves and repair the nerves. Now, it's important to understand that peripheral nerves can be repaired according to the National Institute of Health. The nerves along the spine, the central nervous system, if you have a severed nerve there, they really can't be repaired. So you can repair nerves no matter what anybody says to you. It is science, and so I'm telling you now, we do it each and every day. This is a nerve root with many dendrites. So one of the places that uses our part of our program is the Cancer Treatment Centers in America in order to help those people from chemotherapy. Chemotherapy is one of those causes for peripheral neuropathy, and nerve re-education can be done at home, like I said. So these results in immediate and both pain relief and restoration of normal sensation. Advanced nutrition is a big part of our program. We teach you day by day. We send you recipes. We show you what to do. We actually send you an email every day for 90 days, and after 90 days, we re-examine you. But we teach you. I call you once a week, once every 2 weeks, to make sure you're doing everything right, and you have access to us 24 hours a day, 7 days a week to call us. We are on top of you. In fact, every email, there's a check-off list to see, you have to let me know what you're doing. I need to know you're doing the program. And when I speak with you, I have that in front of me, folks. So I know if you're doing the program or not. So I'm going to tell you what type of patients we're looking for in a little bit. We're looking for serious, motivated patients who know why they're doing this. Because we jump on board with you with your why, and we all help you reach your goal. So the vital components is necessary for optimal tissue repair. Our advanced therapies are designed to accelerate the healing process by affecting the complex process of inflammation, blood flow, and bioavailability of nitric oxide. Pain is inflammation. Our program is designed to reduce inflammation. That's the key, folks. It's not just the nerves on your fingers and feet, it's your whole body. And when you decrease inflammation in your whole body, guess what? Your whole body works better. Especially in these days where the healthier you are, the better off you are, the better off your immune system is to fight off different things that you don't know that are out there. So it's really important to understand this, that inflammation is a bad thing. Inflammation, this is a little diagram of the arteries, can cause thickness in the arteries, can cause decrease in circulation. I see a lot of my patients have cardiovascular issues, and you know what, folks? It's very common to see our patients decrease their bad cholesterol and lose weight. These are just natural side effects of our program. Incredible. One of the technologies we use, in addition to the low-level light therapy and the electrical therapy, is vibration therapy, and this helps increase circulation. This can be done in the office. It can also actually be done at home. So it's really important to understand that this program is a telemedicine program. It also is an in-office program if you can be in the office. We can even do the exams virtually now, as doing them in the office. So this is open to anyone that wants to get better and wants a lot of hand-holding, a lot of emphasis on getting better. I coach you through this whole thing. I have had patients, Donald, if you listen to Donald's testimonial there before, he said, I'm after you, and I'm joining up with you, and there's no two ways about it. Your goals are going to become our goals. So all the best, the treatments can be done at home, like I said, and it's with our telemedicine program. Every program is customized because you're all different, folks. Every one of you is different, and it depends on the situation you walk in and with. We customize the program to your body's needs. To put it simply, we basically optimize your body's ability to heal itself, your whole body, naturally, without drugs, surgery, or injections. Really important to understand that. 85 to 95%, it's actually more than 90%. We're probably closer to 98% success in getting these results in our particular office, the way we do it. So would you like to play catch with your grandkids? Think about those things that they take away from you. Think about all those things you want to do. I hear it every day. I don't need the cane anymore, Doc. I'm not afraid to play with my grandkids and roughhouse with them. I'm not afraid to, to do all those things I used to do. These are really important things. I had a patient tell me that she didn't even want to tell her daughter that she had neuropathy and she had issues with balance because the daughter was going to give her 1-year-old, whatever, little baby to these people, and the mother didn't want the daughter to know she couldn't do this. So that was their why they were in my office, to get better. It's incredible. Everybody has different reasons, folks. So you don't want to, you want to keep up with your significant other. You want to go down to Jersey Shore on the boardwalk. You want to travel. You want to go play golf. I've had patients tell me they want to at least one more time go skin dive. Whatever it is your goal, you have to tell us, share it with us, and we'll help you reach it. So if this sounds like a program you like, you need to be on this program. You need to do something, because I'm going to say it again. If nothing changes, folks, nothing changes. And that's why this is really, really important. So we take the 4.4-part approach. Let's go over it again just to summarize it. We do the low-level light therapy. We do the nerve rehabilitation or electrical device. We enhance your nutrition, and we do the vibration techniques, and that can be done at home. All this done at home and together with our telemedicine, consultations. 90 days later, we do a re-exam and we see where we're at, put you on a maintenance program. So we're looking for 2 types of patients. Type 1, these people are all into their health. They look for things on the internet to see how they live longer, healthier. They want the last 10 years of their life to be vibrant. They want to be healthy. They want to stay on track, and they're ready to do what it takes to enjoy an active full life. Maybe one of you who came on this webinar, you're looking for a solution, right? Maybe you're one of these people too. Type 2 patients are identical to type 1, but sometimes they fall off the wagon. Myself, my staff, we help you get back on track with the program, and we basically are with you every step of the way. Type 3 patients get the worst results in my office. They're not looking for a solution. Maybe they want a quick fix. Maybe they're not really ready to do the work that's going to take. And it's not a hard program to do. It's really an easy program to do. But maybe they're just not willing to invest in their health. That is not a patient that we accept in our office. So the bottom line is we're looking for people who want to get better. They want to work with us. They're motivated, and their significant other is going to help us help them. So that's really important. So here goes, people. What are you going to do? The choice is going to be yours. So here's your moment. Your moment to decide, what it is you want. Are you choosing to keep doing what you're doing? The definition of insanity, folks, is doing the same thing over and over and over again. I think Einstein wrote this, and expecting a different result. So you got to make a change. You got to do something. You got to figure out why you're doing it. What's your motivation? And you'll keep getting the same results, right? You've been getting. So choose something to do about it. Even if it's not with us, folks, do something. Maybe come in and get examined, and you figure out where you're at. Decide what it is you want to do. So do you want to be that person on the left with all the drugs and medications and all these things that they're doing? Oh boy. Or you want to just enjoy your life like the person on the right? What are the last 10 years of your life going to be? Are they going to be the person in your life just sick and keep withdrawing from the things you used to do and losing parts of your life? Are you going to be that person on the right, enjoying the family, doing things with a significant other, just getting and being part of this thing that we do called life? And that's the key. So you have to choose, folks. You're happy. Do you want your happiness to be stolen from you, or do you want to enjoy your life? So your decision, which way you want to go. You want to choose a new life, or you want to stay with the old life? Today is the first day of the rest of your life. It's your choice as to what you want to do, what the rest of your life is going to look like. So here's what happens. You get a private one-on-one consultation. We do a health history. We do an exam, 16-part exam. On the second visit, we do a report of findings, and then we put a plan together for you. This takes about an hour to an hour and a half to do this or to visit. And of course, we want your significant other to be there as part of the team. It's really important. So normally, I want to save you a lot of money, folks, because most of the time that we spend in the office is doing what I just did, explaining everything. So we save that time. So when we save that time, we save you a lot of money. So normally it's $249 if you come off the street, but if you went at a webinar or seminar or you see an ad or a special, it's now basically $47. And that is if you make an appointment today or you pay today, or when you call the number, you give us your name and number, and we call you right, today or tomorrow, and we set an appointment. So again, the webinar special is $47 instead of $249. The first 5 people that we respond today, or call our number today, because we know who calls and when they call, please do that before this time clock runs out. We really want people who are motivated and motivated. I mean, listen, get $47. You get to find out where you're at. You get an opinion if we can help you or not. I don't know if I can help you, but I'll tell you if I can, and I'll tell you if I can't, because I'd rather have a friend in the patient fill get results because you don't understand what it would take. But please be patient 1 or patient 2.
I want to go over a couple things. The 2 questions I get asked 90% of the time is the cost of the program and do you take insurance? Let me cover the insurance thing first. Coverage really depends on each particular individual and their insurance carrier, but coverage varies depending on what kind of treatment plan that I prescribe for you. Each patient is given a unique treatment plan that is custom tailored for them, which is why we have such a high success rate. Now, the out-of-pocket costs are usually affordable from just about anyone, but I can't quote you anything until we meet. There's no surprise cost. You won't be charged for anything without approving it first, and you'll learn more when you come in.
It depends, on how much nerve damage you have. If you have very little nerve damage, it's less cost. If you have a lot of nerve damage, it's more cost. If you've gone over the point of no return, it ain't going to cost you anything, because I got to tell you right to your face, I can't help you. And I really don't want to tell you that, so don't wait. So we have programs to finance it. It's affordable. I have people on fixed incomes. I have people who have bad FICO scores. They can't get credit. We do the financing. Everyone is approved. We try to fit it in your budget. We work with you folks. We try to fit it in. And that's really the key to this. You have to decide. Short of laying in front of a bus to help you, we do everything we can. Honestly, folks, that's really important. So call us or sign up now by hitting the PayPal link on the screen. If you have problems with this, don't worry about it. We'll walk you through the process. We'll schedule. We'll do what we have to do. Folks, you could probably, hopefully you can tell my enthusiasm and passion for helping people. I've been doing this for the last 4 years. This is 41 years now. And I just really care, and I hope you get a chance to look at our testimonials on our website and hear what patients say about our program in reverse neuropathy. I look forward to meeting you. If you have any additional questions, we'll answer them during the consultation and exam. Please make that appointment for the $47. Do it today. I hope to see you. I hope to be able to help you and actually change your life for the better. Thank you, folks, and have a great day.
I wasn't able to do as much with my family, my grandson, which now I've been able to do. Cut back on my insulin. When I went to the doctor, he said, okay, as far as cutting them back, I've been able to play more with my grandson, roughhouse with him a little bit more than I couldn't do before.
My doctor, I went to a neurologist, and I was told that once the nerves are damaged, you can't repair them. Well, all right, so that may be true, but there was no other options for me to go. So it was a simple decision. Whatever I had to lose, just give it a shot. So what I did is I went to Dr. Charles, and he tested me. The testing was not that great. So I said, again, try the program. Well, after 3 months, it's 90 days, I noticed a slight difference here and there.
Right.
And I was retested.
Yeah.
And I found that, wow, I can actually feel these things now, these tools that he uses. And I noticed a difference in walking. I noticed a difference
Okay.
in driving. And on the whole, as far as I'm concerned, this treatment does work. The supplements alone that I was taking decreased my triglycerides by a whole bunch. And it also decreased my cholesterol by a whole bunch. I'm down to like a 167 on the cholesterol. That's unheard of for me.
After 16 treatments, my neuropathy was, I would say, went from where it was hurting me on a 9, 8, 9 scale to approximately 1 to 2 scale. And since that time, which is approximately 8 or 9 months after the treatment, my neuropathy has gone away and I'm able to work. And I also do approximately 200 miles a day in driving. And I was able to do it now. Before, it was pain and agony. And not only that, but at night, I am now able to sleep without gabapentin and Lyrica.
I'm moving away out of state and I'll be living alone. And my daughter was extremely worried about me doing this and wanted me to get a medical alert system, which was a shock to admit to myself that that it was a smart idea. And in the month's time, we both have agreed that it's no longer necessary. I am so stable on my feet. I can carry my laundry up and down the basement. I'm no longer hugging the wall. I walk both my dogs at once. And I am just so hopeful and so positive with this treatment. I'm secure on my feet. My neuropathy is improving every day. I have my equipment to bring with me, and I can still come in and do follow-up treatments, but Dr. Charles has just turned my life around.